Hey everybody, welcome to Health and Wellness West Georgia. I'm Dr. Allison Key of 316 Healthcare, and today I have one of my oldest, dearest friends. That's not a great way to say that. You're not my oldest friend. Someone I've known longest time. Nurse practitioner extraordinaire, Brittany Sleek. Welcome to the show.
Thank you.
Everybody probably knows you. Everybody always says, the pretty one with the red hair. Oh, Brittany, that's the one you're talking about. So I feel like you're an expert in a few fields, some of which we will not talk about here on camera, but one of which I want you to talk about today with me is what we do at our infusion therapy centers, the Physiological Insulin Resensitization. We get a lot of questions about that, and we have a ton of patients having their lives changed on that therapy. So you have taken the reins over there.
I have.
And tell us about that. You're at Bremen Clinic. Jennifer Dinsmore's at our Carrollton Clinic, but there's a lot of collaboration that goes on. Tell us about PIR.
So I think the beauty of PIR is that it's a newer, fresher take on how to resensitize your body to its own insulin. And I think a lot of times diabetics get frustrated because over the years they've tried medications and their body sort of gets used to it, and then it doesn't work, and then we have to add on another medicine. And what we do with the infusions is we kind of restore what's called a negative feedback loop with the hormones, the insulin and the glucagon, and we administer insulin as a hormone instead of a drug. So that helps.
A critical difference.
Yeah,
and the way you think about that.
Because there's so many things out there right now about restoring hormonal balance, and that's really how it works for diabetics. It has a lot of perks with many, many side effects that I have never seen alleviated in traditional Western medications or the traditional diabetic medications that I've used for years. I have seen improvement in neuropathy and wound healing, in fatigue and sleep. That's
kidney function, vision.
Almost feels like a miracle. Like
it does.
Like nothing ever worked, and now this is working for them. So the patients definitely have a big benefit to using this, and also not patients that are not diabetics, that have some nerve problems benefit as well. So it's kind of neat. It's fun because we all got into medicine to help people, and so when they really get the benefit, you feel the satisfaction from your job.
So I feel like when we look at this and we talk about it just on a really superficial level, it sounds kind of voodoo. But when you get into the science, like we went to the training in Texas, it's a patented process. Mm-hmm. I think we were the 44th clinic in the entire United States to be approved to do this, because it's a pretty significant certification process that you have to go through to be able to do it. They're very, very particular and protective because it has the potential to be huge, and they want to protect that intellectual property. So we get all that, but it sounds voodoo-ish, and you get in there and like your inner nerd comes out, and you get in that science, and it's like, oh my gosh, this is crazy. I can't, this is so exciting. And so it's super fascinating, but on sort of a cellular level, we talk about insulin resistance. So when you gain weight, and your genetics play a huge part in this, because you meet people who can be significantly overweight and their blood sugar is always normal, and then you meet people who maybe carry 5 or 10 pounds of extra weight and they're type 2 diabetic, and so a lot of that has to do with genetics, and you can't do a thing about that. It is what it is. And so a lot of what I feel like we do across 316 Healthcare as a whole is really customize therapies, because it's not a one-size-fits-all kind of thing. We have this set of prescription drugs and we can throw these at every single person. Well, that's not going to be effective. So PIR fits in that category where it's a more customizable approach, I feel like. And so insulin resistance, you got cells, they don't have as many insulin receptors on them. So you're not processing sugar like you should, so you store it as fat. So what the solution's been, okay, let's give them more insulin. Mm-hmm. And that doesn't do anything. It makes you hungry, so you eat more. And it's been this like, circle in the toilet. And,
It's a fat storage hormone, so it
Yeah.
makes it harder to lose weight too, the more insulin
that's
you're on.
circulating, yeah. And you're chasing your tail. I mean, we're just chasing that hemoglobin A1C. So for diabetics, hemoglobin A1C gives us an average of how your blood sugars have been doing over the past 3 months. It's really how much sugar is living on red blood cells
Yes.
that live for 90 days. Okay, I'm getting nerdy here, sorry. So we're trying to keep that A1C under a certain level for diabetics, and so we check that every 90 days, and it gives us a rear view mirror look. So we're always chasing our tail. We're always looking backwards, and then PIR, what it does is it reactivates those insulin receptors on the cell. So now you got more receptors again, and it starts restoring how your body responds to a sugar load, whether that's a meal or your sugar's too high because you've been insulin resistant for so long. So if you're diabetic, patients are decreasing neuropathy, pain. The side effects of the medications we use to treat neuropathy traditionally are terrible. So this decreases that. We see improvements in A1Cs. We see less medicine they're having to take. But it's the other benefits that, like there's this one particular patient who's been like a poster child for me. That patient was grumpy all the time, hard to get along with.
Hurting,
miserable. PIR 6 months, and it's like a different person is walking into the clinic.
Yeah.
It's mood, it's sleep, it's
energy,
quality of life, energy, yeah, the whole 9 yards.
Yeah, and they found a lot of that on the idea that, for years we've always thought sugar was so bad, too many carbs, and yes, that's all part of it, but when you focus on the insulin's actual function to open the cell and let the sugar inside the cell, your body really does need the sugar to have energy. That's what gives your body all of those, or I guess the lack of more fatigue, more rundown. So when your body's able to accept instead of push off and that sugar back up in your bloodstream, it's utilizing it better too. So that's part of probably the first couple of rounds, or I would say the first month when they're in PIR, what I hear the most improvements are for fatigue and sleep, really.
Yeah. Brain cells only use glucose for fuel. They can't use any other source for fuel. So that mental clarity, that fog lifts, and people just generally start feeling better. And I think one of the things that perhaps we do differently, 316, again, across the board, compared maybe to traditional offices, is we focus very much on quality of life. We're all very science oriented, and we know that those numbers are important, but we also really, does it matter if your cholesterol is perfect and you're going to live to be 120 if you're miserable and feel terrible and have so many side effects from these medicines?
Right.
I think we do a good job of trying to balance quality of life. And so this is something that we know is making people healthier and improving their quality of life. They do feel better, and that's huge. It's so important. So there's a lot of exciting things down the line for PIR. We know that it's changing lives. So the hurdles, I would say, for PIR is that it is an infusion. It does take 2 to 3 hours. And initially, when you first come to PIR, you do 2 days back to back, 2 weeks in a row, right?
Correct.
So Monday, Tuesday this week, Monday, Tuesday next week. And then you go to once a week. So what are you seeing averages for, like, how long do patients stay on an infusion at a rate of once a week versus every 2 weeks or 4 weeks or 6 weeks? Or
when they first come in to the infusion center, we do some baseline labs, and once they start the infusions, and I get through, being able to look at their charts, their medications, and make sure that we're optimized on all those as well, because it's collaborative. It's not one or the other. It's a balancing act of making sure the medications that they're on are working for them, are affordable for them, we can be compliant, and then letting that infusion kind of, the first couple of times, their sugars are kind of all over the place. We're trying to get to know them, see how sensitive they are to the infusions, the concentration that we're doing. And then once we see improvement in the A1C and we see a stabilization there, then they back down to about every other week. But it just depends on how high that A1C is when they come in and how tolerant they are of coming down. I have several that have come from a 12 to a 6 or 7 in 3 months.
Yeah, that's awesome.
That is amazing, but it also can come with some side effects because that's really, really quick.
Yeah.
So sometimes people just want to go slower and they don't mind and they have the time to come every week.
Yeah.
And I always encourage them, if they can keep that schedule where they're coming once a week, even though it is for 3 hours most of the time, I think that really, their body being reset with that perfect little balance of glucagon and insulin is where their body learns that new way of functioning again, and that's where they benefit the most. So
for sure, that slow and steady pace. You didn't get here overnight. We're not going to reverse it overnight, so we're going to do that slow and steady pace. It's the same thing we kind of approach with weight loss. Like, if you want this to be sustainable, you want this to be something that's going to impact you long term, let's take our time and do it the right way. And so insurance does cover this for the most part. For certain diagnoses, I think it's worth saying when we're talking about this infusion, it's a little pump that you're getting, and it is insulin that, like regular insulin, that was discovered and started being used in the 1950s or 30s or something. Like, we're talking about a medicine that's been around for decades, but the difference is
FDA approved.
Oh yeah,
if
it is
anyone
FDA
has
approved.
That question, it's insulin. It's FDA approved. So
and the pump is FDA approved, and the process is patented and is on its way for full approval in its own sort of definition. But it's exciting to be on the forefront of that, and it's exciting to see the changes that are being made in patients' lives. There's a secondary benefit that we don't often talk about, is when we're doing this, you're kind of in a group setting because your sugars are having to be monitored, and so you've got several diabetics in the room at one time for a few hours. There's a collaborative learning process that happens between the nurses, the patients, the families, the providers, all at that time as well. That I think when you are in a traditional family medicine office, is hurry, hurry, hurry. I've got a patient every 10 or 15 minutes. I don't have time to educate you fully about diabetes and what you should be eating. But now you've got time to come once a week or every 2 weeks and sit, and we can listen and talk and learn. And that is life-changing as well. And it's almost like a support system
100%.
for patients who are learning how to change their lifestyle as well. Are there any negative side effects that you've seen patients experience?
I mean, initially, it's probably could be described as a little bit of a shock to your body, and the first week or so, I do hear a lot of fatigue the day of the infusion. We once we get to know someone and we know how sensitive they are, they have a wait period after the infusion is complete, where we make sure they're not going to drop before they leave. But it happens sometimes that their sugar level does drop. The point of the infusion is, we call it a flight, and there's a little chart for every patient. It's totally customized, but they have a green zone according to their A1C, their blood levels, and where they come in at. And then our goal is to stay in that green zone on them. And the longer we can stay in that green zone, the longer we can reset that balance in their body. So it is important for us to be as aggressive as we can on the infusions without being, while maintaining a safety to it as well. So yeah, of course, if you're getting insulin, they do drop. We monitor their sugar. In many cases, we know that's probably going to happen because we can see the trend coming down, and we either act more conservatively or watch a little closer and check their sugar levels a little bit more often to make sure that doesn't happen. And all the time I've been there, we've maybe had less than a handful we've had, really drop, and us have to stop and push some glucose. And we have seen a lot of improvements too on their A1Cs. So now we've got lower A1Cs, so now we're having to decrease concentrations, but it's a good thing because of the improvement of their sugar. So
we touched on this a little bit. I guess I wouldn't call it a hurdle or a negative, but it's something we acknowledge for patients, is that this is a long-term thing. You're going to do it from now on. Until the technology changes or this becomes something that, or we get you so under control and so reversed that you no longer really need it. And by that time, you sort of spaced out. But I've had several patients that have been my long-term patients that have been doing PIR with you. And you get them spaced out, and they're like, but I feel better when I go every 2 weeks. And there's nothing wrong with doing that. So we'll do it. If you've got the time and can do it, then do that. If it makes you feel better, because again, it's that quality of life. And so what happens when you stop? Well, things can move backwards, especially for like neuropathy. But then you can restart it.
yeah.
and get back going again and improve it again. So I think it sort of depends on where you're coming in the game when you start PIRs, like what's going to happen if you stop it altogether. But in theory, symptoms revert if you're not serious about those lifestyle changes that you've made along the way too.
Yeah.
It's fascinating stuff. It's exciting stuff.
It is exciting. That's what you want, is people to get better. And when they tell you they're better, and it, like she mentioned, it's an informal environment. You feel like family. You celebrate with them. You cry with them. We're all very bonded. And if someone goes through a hardship, we wrap our arms around them. If somebody's having a baby, we get presents. It's just like a neat little group of people. I think a lot of the patients that come in for infusions have had really neat bonding with each other. That's always neat to watch too. But
maybe one day we'll get to host a wedding. Like patients that meet on the infusion floor, they get married in the infusion room.
Yeah, or an infusion baby.
Oh, well. Yeah.
we have a few that are doing that for the purpose of increasing their odds with fertility. So I keep joking and saying, okay, when you have that baby.
That brings up a good point. That was where I was going to kind of close out this episode. Is there are things that you could use PIR for besides diabetes. PCOS is one of them, like fertility issues.
Yes.
It does have a positive impact on metabolism. I wouldn't call it a weight loss therapy, but it does, for patients who struggle with other things, have a positive impact on metabolism. Parkinson's disease, perhaps a famous or well-known in this area football coach, retired football coach who may have
one of your favorites, right?
Yeah. I mean,
the Alabama fan. Yeah,
he's a nice guy.
He's having a lot of improvement from what I've heard on PIR. So
yeah, so Parkinson's. So in theory, if it's targeted for diabetic neuropathy, it has a lot of other benefits, but in theory, it should help with any neurologically mediated disorder. So we've had some patients like with MS even that we've seen some improvements.
I had one with CIDP, which you can work a long time in the medical field and not hear what that is. Chronic inflammatory demyelinating polyneuropathy. Oof. That after about 4 months on infusions felt the bottom of his feet for the first time in 2 years.
That's amazing.
So
it's incredible.
Yeah.
If you think you're interested in something like that, you're welcome to make an appointment for a consultation. Again, we do labs, a thorough exam and history, and make sure that you're qualified to do this and that it's going to offer you some benefit before we hook you into this commitment. But it is life-changing, and it is a novel therapy, and we're the only ones out here doing it. And so we're excited to offer it. Beautiful Brittany will be your nurse practitioner, help take care of you. So email us, reach out if you have questions, info@316healthcare.us about this or any other topics you'd like for us to cover on Health and Wellness West Georgia. Until next time, y'all take care.